Good afternoon students. Today we will see the medical surgical nursing part 2 question paper. 16th question. While a pacemaker catheter is being inserted, the client heart rate dropped to 38. The drug the physician would order is, when the decreasing of heart rate to drop the 38, we will give the option A, atropine sulfate, option B, digoxin, option C, idocaine, option D, procainamide. Option A is the right answer, atropine sulfate. When the heart rate is drops, we will give the atropine sulfate. Option A is the right answer. Next, which of the following is also known as lethal dysrhythmia? Option A, atrial fibrillation. Option B, sinus tachycardia. Option C, ventricular fibrillation. Option D, second degree heart block. Option C is the right answer, ventricular fibrillation. Next, 18th question. Orthostatic hypotension can be modified by option A, wearing support hose continuously. Option B, lying down for 30 minutes after taking medicine. Option C, avoiding tasks that require high energy expenditure. Option D, sitting on the edge of the bed a short time before arising. Orthostatic hypotension means we will give the sitting position. Option D is the right answer, sitting on the edge of the bed a short time before arising. Next, 19th question. The children with cardiac problems who are awaiting corrective surgery are placed on long-term antibiotic prophylaxis. This is done to prevent option A, subacute bacterial endocarditis. Option B, pericarditis. Option C, myocarditis. Option D, lower respiratory infection. Option A is the right answer, subacute bacterial endocarditis. Next, 20th question. In a client on bed rest, the pulmonary embolus can be prevented by option A, limiting the client's fluid intake. Option B, encouraging deep breathing and coughing. Option C, using the kneecap when the client is in bed. Next, option D, teaching the client to move the legs when in bed. Option D is the right answer. When pulmonary embolism, teach the client to move the legs when in bed. Next, 21 question. To record central venous pressure reading, the nurse should place the client in option A, supine position. Option B, dorsal recommended position, side opposite to manometer. Option D, Fowler's position. Option B is the right answer, dorsal recumbent position. Next, 21 question. A test for diagnosis of varicose vein is option A, angiography. Option B, arteriography. Option C, Trendelenburg test. Option D, Rothras test. Option C is the right answer, Trendelenburg test. Varicose veins means we will do the Trendelenburg test. Next, 23. Following a streptococcal infection disorder characterized by swollen joints, fever and the possibility of endocarditis and death is option A, mumps. Option B, measles. Option C, rheumatic fever. Option D, rubella. Option C is the right answer, rheumatic fever is the right answer. Next, pacemaker serves the function normally performed by the option A, SCA node. Option B, AV node. Option C, bundle of His. Option D, none of them. Option A is the right answer, SCA node. Next, 25th. When performing colostomy irrigation, the nurse inserts the catheter into the stoma up to option A, 2 centimeters. Option B, 5 centimeters. Option C, 10 centimeters. Option D, 15 centimeters. The performing colostomy irrigation, option D, 15 centimeters is the right answer. Next, 26. While administering the enema, the height of the container should be option A, 15 centimeters. Option B, 25 centimeters. Option C, 35 centimeters. Option D, 45 centimeters. Option D is the right answer. 45 centimeter is the right answer. Next, Interception is option A, telescoping of a proximal loop of bowel into a distal loop. Option B, kinking of the bowel onto itself. Option C, connective tissue compressing the bowel. Option D, protrusion of an organ into another. Option A is the right answer. Telescoping of a proximal loop of bowel into a distal loop. Next, 28. Barium enemas serve to option A, illuminate the alimentary canal, dye the alimentary tract and provide color contrast. Option C, give off visible light on, illuminate the alimentary tract. Option D, absorbs X-ray and thus give contrast to the soft tissues of the alimentary tract. Option D is the right answer. Barium enema is giving absorbs X-rays and thus give contrast to the soft tissues of the alimentary tract. Option D is the right answer. Next, 29th question. In hemorrhoidectomy, post-operative care should be given. Option A, administration of laxatives and stool softness. Option B, administration of enemas to promote defecation. Option C, dressing of area. Option D, encouraging shower if needed. Hemorrhoidectomy patient post-operative care is first we have should administration of laxative and stool softness. Option A is the right answer. Next, 30th question. There are 8 essential amino acids. This means that option A, this formed in the body. Option B, this formed in the body and essential for growth. These are not formed in the body and obtained from diet. Option D, these are essential for life. Option C is the right answer. 8 essential amino acids are formed in the body and obtained from diet. C is the right answer. So we are discussed medical surgical nursing part 2 question paper, and tomorrow we will see the part 3 question paper. So please do subscribe, like and share my channel. This is useful to RRB and staff nurse examinations, ESI and Aiims NORSET examination. It is the medical surgical most important questions. Thank you.